So how did the experience of being a patient and being diagnosed with breast cancer affect the way you practice medicine?
Well, it really allowed me to see firsthand what it's like to receive unpleasant, distressing news that could obviously affect your own mortality. And it also gave me an opportunity to see what it's like to live with pain or live with a disability that you just want it to go away like really fast. And I mean, even though I'm a physician, when you're sick, you're a person. And I had a lot of complications from the chemotherapy, which just gave me more insight into that level of suffering and discomfort. And I think I was able to use that to help understand what the patients go through.
Mm-hmm.
And I think certainly many of the breast cancer patients have told me that talking to me has been useful to them, because you tend to sort of think, I'm the only one who's ever been through that. And you're not, but you need someone else who's been through that to share it with you.
Mm-hmm. Are there common dominant reactions that people have to physicians? I just assume that some people give physicians like a godlike authority. No, not in America.
Not in America, no. No, those days are over.
Some have a chip on their shoulder about
yes, well,
and
I think today patients are better read. They come in, they've looked up something, they've been on the internet, they've read something in the Wall Street Journal or Time magazine. So I think they're much better informed than they were maybe 20 years ago. And I think many physicians today try to have a relationship with the patients. It's not so much we're telling you what to do, but these are the options. Let's try to pick the best plan for you. It's a mutual working arrangement. That's the way I think it's the best way.
And you've seen this change just during your own practice?
I have, yes. And I've seen, and that's the way I work with my physicians, and I think that's the way many physicians now work with their patients. It's less authoritative, less didactic, it's more friendly towards the patient. However, there is sort of a bottom line. If a patient said, let's say a patient needed a medicine for their heart, I think most physicians would say, if the patient balked, you really need this medication. This could be life-saving for you. I don't agree with you not wanting to take it. I can understand your hesitancy, but I really want you to consider it.
Right.
So I think there would be sort of a fall-off point where, as a physician, you sort of have to say, look, you really need this.
Mm-hmm.
For example, a patient fell the other week. She had a horrible abrasion on her leg, and I said, you really need to get an x-ray. She didn't want to get an x-ray. And I said, but you're elderly. She's a white female, high risk for osteoporosis. I said, I really advise you to get an x-ray. So she did. It was negative, which is great. And I told her, physicians are in sort of sometimes a lose-lose situation. If we don't get a test, oh, that person's negligent. If we push for a test, oh, they just want to do a lot of tests. We don't get a benefit out of doing the x-ray. Our only benefit is to help the patient. And I think sometimes that gets lost in the whole spectrum of looking at trying to evaluate what a physician is doing.
I noticed a lot of stuff about dermatology on your website.
Yes, we do. We offer many skin care services. We have an esthetician who comes here and does facials. We also provide microdermabrasion, oxygen facials, laser hair removal, pulsed light laser to help people who've had sun damage to their skin, and we do Botox and Juvederm. And we do Botox for cosmetic and for therapeutic reasons. So there are some patients who have severe neck pain or cervical dystonia, and their insurance companies may cover part of the cost of that. So we do a whole range of services, and that's another way to help people, and we love doing it. It's really great. So let's say we'll have someone come in for acupuncture, their pain is improved, and then they see that we do other things, so then they want to do those other things with us. So that's really great.
How long have you been in California?
I've been in California for 22 years. I don't know how that has happened, but time just flies by. And I love California. I do.
Do you think, how is Pasadena perhaps different from other places where you may have practiced medicine? The concerns of people pretty much identical to
I think the concerns are pretty much very similar. People want to feel good. They want to know that they're looking at health risks, reducing those risks if they can. I think that's pretty universal. I think Americans in general want to be healthy. I think sometimes we don't know the best way to do that, but I think we do want to be healthy. I do think that maybe people in California exercise more consistently. That's one thing that I've seen.
I'm from Australia, so one thing that struck me, first thing that struck me when I came to America was how fat so many Americans are.
That's true. It's a huge problem. It is a huge problem. It's not a good thing.
And the portions are so big
They
here.
are huge. And so I think what happens is people are served this large amount of food and they think, oh, I'm paying for it, so they feel compelled to eat it. Yeah.
I know I do. I feel compelled.
You do. And so, we're trying to encourage people to take some of it home, to maybe order something that is a smaller portion, or order a salad, maybe a chicken salad where it's going to be more lettuce, something like that. But you're right, the portions are large, and there are a lot of people that need to lose weight.
What do you love and what do you hate about your work?
I love working with the patients. I love helping them figure out a therapeutic plan that works for them. The thing that I hate probably the most is the difficulties we have with some of the insurance companies.
Is medicine more bureaucratic today
Yes,
than
it
20 years
is
ago?
much more bureaucratic. And you have to, if you're in a plan, if you're a providing member in that plan, you have to follow every little thing in that plan, pretty much. And I think insurance companies have a lot of power.
How has your knowledge and practice been changing in, say, the last 10 years?
I have been consistently looking at different techniques, new techniques to either reduce pain or reduce lymph swelling for some of the cancer patients, or for even a woman who just has a lot of bloating with her period, and just looking for new and innovative techniques to improve people. That's pretty much our little motto is healthy inside and outside. We look at the total person. If you come in for Botox, for example, we are going to ask you, do you have any other health problems? Are you taking, even if I'm not going to be their primary doctor, I'm just concerned because sometimes we can help somebody go into the right direction. For example, a young lady came in for laser hair removal about a year ago. And she said, oh, I have a history of a heart murmur, and I was told to take antibiotics. And I said, really? Did they do an echocardiogram on you? And she said, no, this was just a diagnosis from her physician when she was a young girl. So we encouraged her to get an echo through her health plan, which she did. It was fine. So therefore, she didn't need antibiotics before dental work. And that's huge because every time you take an antibiotic, you have the risk of an allergic reaction. You don't want somebody taking a pill if they don't really need it. So I think that's a pretty good example of, even though, and we did her laser hair and she did fine, but just that history, and I listened to her heart and I said, I don't hear a murmur, you should just get an echo, have your doctor get an echo, and that worked out for her.
Do you notice a difference in the way that men and women relate to medicine and to doctors?
Yes. Men are generally more resistant. They don't want to do anything unless they're bleeding to death, and they don't want to follow advice. Sometimes you have to work harder to convince them that they need a medication or they should do testing until they have been sick. If they've been ill and they've been through the system, they're a little better. But that is a big difference I see in men. Because women go to the doctor all the time. We go to the doctor, we have our pap smears, we have babies, we do all sorts of things. We take our kids to the doctors. But men just generally don't go unless they have a real problem. Usually pain or blood. I threw up blood, I saw blood, I can't move a joint, then they go to the doctor. That's true.
Absolutely. That totally conforms with my understanding of myself and with life. Certainly. There are certain common responses that people have to their mortality. I mean, you must have dealt with patients who saw that the end was near.
Mm-hmm.
How do people relate to that
I
mortality?
think when people know or feel that the end is near, that they have reached a certain level of acceptance, and they're usually very sweet, very easy to work with. They don't let little superficial